This is a podcast. Greetings, pod recipients. You are entering the Savage Nation.
America is being invaded by deadly viruses. Some will say I'm an alarmist, or I'm a thisist, or a thatist for making such a provocative statement. Well, they're wrong. The only ist I am is an epidemiologist by training. The fact of the matter is, diseases that were either eradicated or previously contained are now threatening you and me, thanks to President Obama's failed open borders policy. The liberal media won't tell you that, but I must warn you that your safety, your security, and your health are at risk.
Warning, the Savage Nation contains adult language, adult content, psychological nudity. Listener discretion is advised. The Westwood One Podcast Network presents The Savage Nation. It's savage, uncut, unfiltered, and raw. Home of borders, language, culture. And here he is, New York Times bestselling author and National Radio Hall of Fame inductee, Michael Savage.
Welcome to today's podcast. It's a topic that I know a lot about, and that is immunity. Why am I talking about immunity? Don't turn it off yet. Hold it now. Even you, Mr. Millennial. Remember this, diseases do not discriminate. You could be the most left-wing fanatic, and if there's a bug around, it's going to get you too. It doesn't know you're such a good person who loves illegal aliens and loves everything communistic. You'll die from it just as well as the right-winger will. So why don't you pay attention and learn something? Get your head out from underneath the clouds of smoke and listen. Listen very carefully. We are facing an unprecedented assault upon our nation. Now, you may say, oh, this is just right-wing hyperbole. All immigrants, we're all descended from immigrants. Well, that may be true, but it's not true in the sense that when your ancestors came here, if they had a disease, they were stopped at Ellis Island, no doubt, and either sent back to the home country until they got better, or they were quarantined. You know what that word means? Quarantined. They were put into a quarantine and treated for the tuberculosis or whatever illness they may have had. Now, quarantine ended with the advent of the AIDS epidemic owing to the tremendous lobbying of the pressure groups surrounding the AIDS epidemic. When the word quarantine came up, all hell broke loose. All right, so we shouldn't quarantine anyone no matter how bad the disease is, right? Wrong. People are quarantined today in hospitals if they get a strain of tuberculosis that is, let us say, incurable at this time. So quarantine does exist even today. Okay. Unfortunately for the rest of America, the damage that has been wrought upon America as a result primarily of Barack Obama and the Democrats, simply to stock America with illegal aliens, primarily from South America and the Middle East, for voting purposes and to change the demographics of America away from that of the Caucasian, will in the end destroy America as you know it. It will not be a better place. It will be a place like they came from. But in addition to that, in addition to the hellholes that they ran from, which they refused to leave behind psychologically and culturally and socially, we are having mini pandemics. Mini pandemics. You haven't heard about that one, I realize, in the protocols of liberalism. Mini pandemics. Mini pandemics. From the delusion that the best interests of the nation are at heart in bringing in as many immigrants as possible. What is clear to all of us is that the best interests at the heart of Democrats is the heart of darkness, bringing in illegal immigrants to vote for them, to suck the social services dry, bringing in illegal immigrant children harboring viruses and communicable diseases, which I will tell you about specifically. You may not know this, but Barack Obama's desire to put America last has hit our most innocent first. Did you know that in Ohio, California, and Kansas, amongst other states, there have been upsurges in measles outbreaks? Yes, you heard me. Measles outbreaks. But worse than measles, thousands of children in 10 states, Missouri, Kansas, Illinois, Kentucky, Iowa, Colorado, Ohio, Oklahoma, North Carolina, and Georgia, to name some, have become infected as a result of Barack Obama's flooding America with infected children from Central America with a rare respiratory virus not seen in these numbers since the 1960s that is called human Enterovirus EVD68. Remember this code, EVD68. This virus, EVD68, is responsible for the paralysis that is occurring in many children in the United States of America who have had no immunity to this virus. The problem for America was that Obama flooded America with children primarily from Honduras, where this virus, EVD68, is endemic. In fact, there is an illness in Honduras called the Honduran Flu that is caused by the virus EVD68. So with this potent formula for disaster, bringing in unaccompanied minors with EVD68 and other contagious diseases, flooding over our borders, being bussed into our communities by Catholic charities and other organizations, brought into our schools, brought into our hospitals, our children have become infected. So where did EVD68 originate? And did it enter the United States through the illegal children? Well, that's something to talk about at another time. Bringing in children from Honduras and Central America with this virus harbored in their systems. You see, they may have the virus lying there and they may not be showing the illness. But the kids are then thrown into our public schools overrun by illegal students infected with God knows what kind of illnesses. And so we don't know exactly where it came from. But the flood of children from south of the border have brought with them third world diseases that are likely the primary source of this polio-like paralysis that has now become a national problem that is being swept under the rug by those at the National Institutes of Health. And I don't even think President Trump understands the connection between the invasion of the illegal children and Enterovirus EVD68. If he did, he might give a talk about it and perhaps use that to stop this invasion.
Michael Savage, a host like no other.
Now, the CDC, which is our Centers for Disease Control, which was once a fine agency of medicine and science, which has now become the Center for Democrat Control, had the nerve to blame the spread of this rare virus on seasonal allergies at the start of the school year. And instead of saying that illegal children should be quarantined and treated, or better yet, rounded up, treated and sent back to their home country, these so-called unaccompanied minors, are you listening to me, are put into our schools with running noses, sneezing, coughing, and that's why our children are becoming paralyzed. This all began with Barack Obama. But my friends, it's not the only disease that has resurged that was once eliminated from the United States. Measles is another problem. I'll get back to this one in a few moments. In medical history, measles was first identified as a unique disease by the Persian physician Raziz in the 9th century when he published a text entitled The Book of Smallpox and Measles. You see, measles is an ancient disease that used to have a profound global impact that led to hundreds of thousands of deaths, millions of cases each year. Even the island of Cuba was affected because in the 16th century, a measles epidemic caused the deaths of 2/3 of the population of Cuba in only 1 year. 2 years later, measles killed half the population of Honduras. In the 1850s, a measles outbreak caused the death of 20% of the population of Hawaii. Between 1840 and 1990, measles was thought to have, or it was analyzed that measles killed about 200 million people worldwide. And what happened then? Well, in the decades before 1963, when a vaccine became available, nearly all children got measles by the time they were 15 years of age. They got it, they suffered with it, and they got over it, right? It is estimated 3 to 4 million people in the U.S. were infected with measles every year before vaccination. Also before vaccination, an estimated 400 to 500 people died. 48,000 were hospitalized, and 4,000 suffered encephalitis, a swelling of the brain, from measles. What happened then? The measles vaccine was introduced. It is one of the most important public health discoveries and interventions in the past 100 years. John Enders and colleagues used the Edmundston B strain of measles virus to create a vaccine in 1963. In 1968, Maurice Hilleman and his colleagues developed an improved and even weaker measles vaccine, the Edmundston-Enders strain, that has been the only measles vaccine used in the U.S. since 1968. And so, even though the complete eradication was not achieved, by the year 2000, the U.S. had no continuous transmission of measles disease for more than 12 months, and measles was declared eliminated in the United States. That was by the year 2000. But now it has resurged. Why? Well, ask your friend Barack Obama about why. If you bring in children from Honduras, El Salvador, and Guatemala, as they are now pouring over our border, many of them are infected with measles and they're unvaccinated. Any other questions, you stupid idiots? You're committing suicide out of your kindness. Now we're going to talk about other diseases, and we're going to talk about the EV D68 polio-like illness, which I touched on. We're going to talk about that in great detail. We're going to tell you what you might do to augment your immune system, how to treat it if you can treat it, because there is no treatment, how you can protect yourself and your children from EV68. It's a very serious problem. The serious problem could have been stopped. It could have been prevented if only we had a government that thought about the American people first instead of the American people last.
The Savage Nation. It's savage, uncut, unfiltered, and raw.
Let's talk about double chins now. I mean, you think it's just going to disappear? You took your whole life to build it up. Think those bags and puffiness, which are getting worse every day, are just going to go away? No, they're not going to go away. And here's what Robin S. from Lubbock, Texas says. She said, I put that jawline cream on my neck like 2 or 3 days ago. That is the best my neck has looked in over 20 years. Several people told me my face looks young. I am blown away. You see, with Genucel's natural actives and a pure antioxidant base with no parabens, no chemical scents, and no pharmaceutical preservatives, it is the clean luxury your skin deserves every day. If you order right now, the Genucel jawline treatment is yours absolutely free, just for ordering the classic Genucel plant stem cell therapy for bags and puffiness. You heard me right. So text SAVAGE, that's SAVAGE, to 77453. Text SAVAGE to 77453, or go to Genucel.com. That's Genucel.com. Genucel works for men and women, and for results in 12 hours or less, the Genucel Immediate Effects is also included free. The Genucel Immediate Effects is also included free. So order now and get free 3-day shipping. Again, text SAVAGE, SAVAGE, to 77453. Simply text SAVAGE, SAVAGE, to 77453 and get all this free stuff. Or go to Genucel.com. That's Genucel.com. Let me at this time go to a small ebook that I authored a few years ago entitled Diseases Without Borders. Diseases Without Borders. It's inexpensive. It's $2.99. Diseases Without Borders, Boosting Your Immunity Against Infectious Diseases from the Flu and Measles to Tuberculosis by Michael Savage. Dr. Michael Savage, by the way, my Ph.D. is from the University of California at Berkley, in a combined field of epidemiology, human nutrition, and medical botany. Let me read a little bit from Diseases Without Borders for you. And if you find it intriguing, maybe it will help you. You could pick up an e-copy. Your mother knew enough to stay away from people who were sick, right? When flu season approached or when you were feeling a little under the weather, she told you to do certain things that promoted healing. Well, in some ways, my little booklet will be like your mother's advice, only it's written by a Ph.D. scientist. Having published many books on the subject of nutrition and immunity over several decades and having earned my doctorate in nutritional ethnomedicine from the University of California at Berkeley in 1978, I am as or more qualified as anyone in the media to tell you what is known about boosting your immune system against viral illnesses. It's a well-known fact that no medications currently exist on the market that could stop a viral infection. While there are some antiviral drugs, they're not recommended in these cases as a preventative. Those antiviral drugs may be useful in treating serious diseases such as Ebola, but they are definitely of no use to prevent a viral infection. Your best defense is a strong offense, specifically boosting your immune system to lower your susceptibility to infection and disease. That means staying away from illegal aliens. Don't give them mouth-to-mouth resuscitation. Don't hug them at the border. Don't pull a Joe Biden on them. So how do you boost your immune system? Well, these are commonsensical techniques, by the way, as any qualified medical doctor will tell you. She would recommend a healthy diet, regular exercise, and sleep, most importantly, as well as stress reduction. We've also heard about hygiene. They're all important, but they don't go deep enough. In this book, Diseases Without Borders, I dig deeper, offering you information on fortifying yourself against viral infections and other diseases. I'll show you how to boost your immune system to maximum levels without using drugs. In fact, for the price of one beer or a glass of wine, this information might just save your life. Let me be very clear. I wrote Diseases Without Borders, and it was designed not to treat or cure influenza or the common cold. It does offer your best bet should you come in contact with any virus, including influenza. I'm talking about fortifying, yes, supercharging your immune system against viral infection. And here you will learn the necessary steps to take to give yourself the greatest chance to ward off the common cold, the flu, and other viral diseases. Now, you might say that the Dr. Savage prescription for good health is the savage truth. My plan is necessary because you must be sufficiently motivated to act before a disease strikes, especially as our government officials have botched the basics of disease prevention. Worse, as you will see in this small book, the policies of the current administration are aggravating the spread of certain diseases, placing you and your family at unnecessary risk. I'm going to give you a freebie right now, a little piece of Chapter 1 from Diseases Without Borders, Boosting Your Immune System, a Kindle book that you can order immediately on Amazon. And it begins, strangely enough, with epidemics from EV, D68, and measles to tuberculosis. Chapter 1, Diseases Without Borders, Epidemics from EV, D68, and measles to tuberculosis. America is being invaded by deadly viruses. Some will say I'm an alarmist, or I'm a thisist, or a thatist for making such a provocative statement. Well, they're wrong. The only ist I am is an epidemiologist by training. The fact of the matter is, diseases that were either eradicated or previously contained are now threatening you and me, thanks to President Obama's failed open borders policy. The liberal media won't tell you that, but I must warn you that your safety, your security, and your health are at risk. Why? Because the border is more porous than your grandmother's flour sieve. For 25 years, I've been trying to warn America about the dangers and risks associated with bringing into this nation unscreened, unvaccinated immigrants. Today, this lack of vigilance is causing outbreaks of so-called mystery diseases and illnesses throughout the land. More on that in a moment. You see, Americans once enjoyed the greatest health and health care on earth, but because the Obama crowd and the leftists in government today are so corrupt, not to mention ignorant about the basics of germ theory, what was once the greatest nation on earth is now on its way to achieving second-rate health status as a nation. Media lapdogs dutifully overlook what this illegal alien invasion of our borders is doing to the health of the nation. An infestation orchestrated by the Obama White House for political reasons. We now have a growing number of cases of TB, measles, dengue fever, hand and foot mouth disease, and Chagas disease, all of which were previously controlled or eradicated in the United States of America. We are also encountering new deadly diseases, previously unknown within our borders. You see, for centuries, America has had the protection of her geographic isolation from contagions that had never seen the light of day, be they diseases from the east or the west. We were blessed with geographic isolation from the viral horrors plaguing the third world. Granted, some diseases have been here and were endemic, such as malaria, yellow fever, cryptosporidium, and polio. Thankfully, advances in modern American medicine snuffed out many such epidemics. Today, however, a number of previously conquered diseases are being reintroduced because of this reckless government run by the illegal alien lobby, the mafia of the illegal aliens, the leftist Democrat Party, and, of course, the Catholic charities and other such so-called religious groups that are hell-bent on obliterating our borders. Frankly, this group of anti-Americans has done everything but personally driven illegals across the border in limousines. It is a well-established fact that the United States Border Patrol agents have been reduced to border babysitters who have been instructed to stand down as hordes of illegals pour over the southern border. In the process, illegals flood in while our agents are exposed to life-threatening diseases, and some are testing positive for viruses including H1N1 swine flu, chickenpox, a drug-resistant strain of tuberculosis, which is a bacterial illness, has been introduced to Lynn, Massachusetts, courtesy of these kids, the hordes he brought in from Central America by the trainload under Obama, and then sent through unsuspecting communities to change it from white to something else. You think I'm making it up? Talk about community organizing. Don't take my word for it. Agent Chris Cabrera, vice president of the National Border Patrol Council, told a news outlet that his border agents are suddenly coming down with diseases this country hasn't seen in decades due to the endless stream of illegals, many of whom are sick with scabies, a contagious skin infection spread by a mite parasite buried under the skin, and tuberculosis, an oftentimes fatal infectious disease which attacks the lungs. Agent Cabrera asserted we had one agent get bacterial pneumonia a couple of days ago. A lot of guys are coming down with scabies or lice from these people. We're having a lot of diseases coming in. Some of them we haven't seen in decades in this country, and we're worried that they're going to start to spread rampant throughout the United States, especially if we're releasing people that have these diseases. What's the translation? All of America is at risk because we have no idea where these illegal immigrants are ending up within the United States of America. Now, I could go on, and I will, about the big chill and government censorship, but I don't think I need to tell you that the government is covering this up. If you've enjoyed this sample of this Kindle book, it's very inexpensive. It's the price of a beer, and I wrote it not to get rich quick, but to get you as secure in your immunity as I could, as quickly as I could, for a few dollars. I'm not a voice crying in the wilderness out of nowhere. I've been telling you about this for many years. I warned of it in an ebook that I wrote called Diseases Without Borders, and I've been warning you on the Savage Nation. So here I am, going back to 2016. I want you to listen to this. Here is a caller, an Indian doctor, an immigrant Indian doctor in New York City, trying to argue with her about the outbreaks of diseases in the U.S. and where they're coming from. Listen to how obstinate she became. Listen. Savita, go ahead, make your point on the Savage Nation.
I am from India, an immigrant and a physician. And I do not agree with some of your points. Measles will spread wherever there are people exposed to each other. Immigrants have nothing to do with measles.
No, whoa. You just made a big leap in faith. Measles happens to be endemic in certain nations on the earth. Is that not correct, doctor?
Yes, but may I finish my point?
No, you may not. You may continue in a moment because you made a misstatement that was meant to mislead people. Is there a link between measles, the measles outbreak, and illegal immigration? I'm saying yes, and you're saying no.
I am saying that measles in the states that apparently you're a resident of, where people are not even taking the vaccines that they're supposed to be getting, and you're implying that that your little baby has to have a vaccine because those illegal immigrants are bringing measles, is disingenuous.
Savita, when did the measles, the incidence of measles, increase in the United States of America? Do you know the answer to that? I'm asking a question since we're having a rational discussion. When did the measles incidence in America, when did the incidence of measles in America increase? Do you happen to know the year?
No, I don't know the year. But it's your program, and you must have looked it up, and I don't have to know this.
But you made a blanket statement as though you had all the answers because you just said that immigrants have nothing to do with the measles epidemic, but you are wrong. Do you know that the Enterovirus has a heavy presence in Central and South America? Are you surely aware of that as a doctor, aren't you?
Yes, I am. And Enterovirus is common in many, many other tropical countries, including the country that I'm from. Yes, they are endemic. Look, third world is going to have more infectious diseases. There's no doubt about that. And
so why are we bringing in infected people from the third world? How does that benefit a nation to do that?
Okay, why does it? You are saying that I am no pro-Obama person, but for me to, when I, going from one point to another to the third, and somehow getting them all together and calling Obama the corrupt person. Well,
but now you're changing the subject. I caught you in a mistake, and now you're going back to Obama. I thought we were having a rational scientific discussion. You just admitted that the incidence of measles is higher in certain nations than others. I said, what sense does it make to bring in infected individuals to the United States of America? What's the answer to that?
Okay, you are saying that you said just now that Somalia, we have been getting 70,000 odd people every year for the last 30 years. I think during that time, Obama has not been the president all along. So what was...
I didn't say it was Obama. I said it started with Kennedy, the drunk. That's what I said.
Calling people names does not...
He was a drunk. He was a well-known drunk.
But
What's wrong with calling a drunk a drunk? He lied to the American people. Long before you were in this country, we had a man named Edward Kennedy who was a liar and a drunk. And when he passed the Immigration Reform Act of 1965, he said that the immigrants that we will bring in will not affect America negatively, and we will not change the demographics of the country, and they will be perfectly fine, and they will become assimilated. He lied about it. Why shouldn't I be outraged? Why shouldn't I point fingers at him?
Can I say something?
Don't play the game like you're in a hospital ward playing the game with me. You've been saying an awful lot, and everything you said made no sense so far.
I am being polite. I'm not yelling. I'm saying, may I say something?
All right, so many people kill you with politeness. I get it. And many people who are angry are very good people, but they're not polite. And many people who are polite are very evil people. I've met them all my life. The polite ones are the ones who put a knife in your back. How about the uptick in tuberculosis, HIV, hepatitis C, and tuberculosis? Where do you think it's coming from, Dr. Savita?
Okay. Where it's coming from is in the U.S. There are pockets, inner cities. There are places that people do not have access to health care, and they live in close quarters. HIV epidemic...
No. You're distorting reality. It is being imported from the third world. And the only way to reduce the incidence is to slam the doors shut and to start deporting infected individuals back to the hellholes they came from. And you'll tell us that measles was endemic in America, that tuberculosis was endemic in America, and the immigrants had nothing to do with it. That's a total falsehood. Okay. Tuberculosis was virtually eradicated in America until approximately the end of the Vietnam War, when we were flooded with Indo-Chinese who came here infected with tuberculosis. Are you aware of that?
Tuberculosis was endemic in China. But calling people names...
Again, you're going back to the wrong point. We are having a scientific discussion. You didn't hear a word I just said because you don't want to hear a word I say. Tuberculosis was virtually eradicated in the United States of America until the end of the Vietnam War. And then something happened. And that is the boat people were led into America, mainly Vietnamese and Cambodians, the Indo-Chinese, many of whom were infected with tuberculosis. Are you aware of that?
When should the border have been sealed? Because apparently...
Well, now you're changing the subject because you can't answer a single question. I can see how you got your way in the medical world. But you're not going to get your way with me, because I'm not one of these polite dunces that you've worked over your whole life in the medical world. Now, goodbye, and have a nice day, and I'll be right back. You can see from that the delusion that they're selling to try to prop up immigration at all costs. But I laid out a detailed explanation about what was happening then and why it was happening. Listen. The first hour was about immigrants and epidemics because of the shocking new story that came out from Breitbart, by the way, based upon State Department of Health in Minnesota data, that 1 of every 5 refugees resettled in Minnesota by the illegitimate, fascistic, lying federal government tested positive for latent tuberculosis in 2014. That means 1 out of 5. And amongst those, 26% of all foreign-born cases of TB in Minnesota were from immigrants from Somalia. And Somalians almost exclusively enter the state through the refugee resettlement program, which is a way of getting around immigration law itself. We are then looking at other diseases brought in by immigrants over the years. Popular radio talk show host Michael Savage, who you are listening to, who holds a doctorate in nutritional ethnomedicine, one of which, the major within that, his epidemiology, said this. I'm quoting myself now in an early article. The socialist government, media, academia, medical apparatchiks have looked the other way or changed the origin of numerous illnesses which were once eradicated in our once first world nation. Since the massive influx of illegal alien children from Central America who are not being medically screened, the United States has had outbreaks of numerous illnesses that were once eradicated, such as, take notes, doctors, dangerous strains of influenza, tuberculosis, measles, mumps, rubella, smallpox, leprosy, and even malaria. And yet these outbreaks have been covered up by the criminal Obama administration appointees at the CDC, all of whom are committing perjury and should be tried for perjury. Every day the Obama administration continues to violate federal immigration quarantine laws. Infectious diseases will continue to infect the general population, and children who are required to go to grammar schools, along with the illegal alien children from Central America. If you would like some examples, all of you who have your minds made up on this fine May day, numerous epidemics sweep Central America, and there is an aggressive mosquito that transmits the deadly Enterovirus EVD68 and yellow fever, and some infectious diseases are transmitted by insects, including the new spread of dengue fever, which was once eliminated in America. But EVD68 was responsible for at least 14 deaths in the U.S. It also brought around the first cases of paralysis that we had seen in decades. I can read you the list about illegal aliens bringing in many infectious diseases into the United States, like Measles, EVD68, dengue, flu, etc. I did. But the children themselves who are coming in are transporting mosquitoes that are carrying very dangerous infectious diseases in their clothing, Catholic Charities. The Obama administration continues to flout quarantine laws in order to facilitate the massive illegal entry of illegal aliens through the southern border of the United States. This has created a public health hazard for your child enrolled in grammar schools and for the general public in communities throughout the United States. So the liar-in-chief gets up there at his college speech and talks about the elimination of diseases like polio while ignoring completely the diseases that have been that are resurgent in the country as a result of his criminal immigration policies. Look, I'm an immigrant son, and many of the things that are being said about this wave of immigrants into America were said about my grandfather when he first came here. I recognize it. So I ask myself, is this just nativism and racism, or is there something different about this wave of immigrants from the time that my grandfather came here? And it's not just my grandfather. It could have been Italians. It could have been Irish. They were all spat upon by the general population when they got here. But there was a huge difference at that time. You know what the difference was? All of you socialists out there, we did not have a welfare state. Now, the famous inscription on the Statue of Liberty says, "Give me you're tired, you're poor, and you're hungry," right? And we say, wow, see that? Even in 1904, we were looking to help people from around the world. That's a lie. First of all, there was no welfare state. Zero welfare state at that time. None. There were no food stamps, no government cheese, no welfare at all. The people came here, either they worked or they died. But more importantly, if they showed up at our borders at Ellis Island and they showed any sign of infectious disease, they were either sent back to their country of origin or they were put in quarantine until they were cured of that disease. Moreover, any immigrant coming into America had to show that they had a sponsor who could support them, because the government certainly wasn't going to support them. We had a legitimate government then. Now we have an invasive government that may as well be a third world government that has taken over this country to flood us with third worlders, to make us less like America and more like the hellholes around the world. And that's how 30 to 40 million Americans see this issue. I'm not the only one. If I was the only one, I wouldn't be on the radio. I wouldn't have lasted a day. But I started my career 22 years ago fundamentally talking about immigrants and epidemics. And it's gone up and down, it's waned and it's waxed, but now it's reached a new crescendo. Now, Donald Trump came along, and he achieved immense popularity by talking about building a wall with Mexico and about banning the immigration of Muslims into America until, quote, we can figure this thing out. Why do you think the average American responded to that? Is it because we are inherently bad people, inherently racist, inherently nativist? there may be elements of that? No, it's because we inherently have survival skills. We as people inherently know what is good for us. And we also can smell a rat when we see a rat, even if the rat's wearing clothing and a white collar. And many of us understand the danger he is putting us in on a daily basis, which again brings us back to the primary question, for which I don't think we're going to find an answer, which is, does he do this out of an altruistic desire to be a man who is good for the world and for his own country? Or is he doing it for more nefarious reasons, primarily because he hates America and wants to do things to weaken it? That's a question that rages through the minds of millions of Americans.
Now, if you still don't believe me, here's a news report from October of last year from liberal ABC 15 in Arizona on diseases coming into Texas from illegal border crossers. You won't hear it anymore, though. That was a year ago. They won't even report it today. Listen.
They're seeing crossers with contagious infections, and sources tell me right now, all that's separating the sick from the healthy, this caution tape, and agents tell me that's not enough.
We're sending people everywhere, and the average person, the average citizen doesn't realize what's going on down here.
Agent Chris Cabrera's concerns go way past the hundreds of women and children that cross the Rio Grande River every day in southern Texas.
We're having an outbreak of scabies that it's been going on for a month or so now.
The illegals will come across, they'll jump that fence.
Texas border resident Jorge Garcia says word about the contagious skin infection is getting around.
Our Border Patrol comes and checks with us almost on a daily basis here, and they told us about an outbreak of scabies here at the McAllen station.
And that's not all.
We're starting to see chicken pox, we're starting to see staph infections, we're starting to see different viruses.
Garcia believes the viruses are not confined to the detention center. Not long ago, a group of border crossers came knocking on his door.
It was a 7-month-old baby. The baby was shaking and cold. It had a high fever.
We're told the Department of Homeland Security called in the Coast Guard medics. This trailer is just one of many used to treat the sick.
They're all contagious. So now we're transporting people to different parts of the state, different parts of the country, and some of these viruses are asymptomatic at this point. They're not showing the symptoms.
Just the fact that we're exposed to it, and so is everybody else here in South Texas, is a great concern to us.
And thousands of those immigrants that were detained, then released, are now spread all over the United States, including Arizona. It's unclear how many were treated for illness. And as of right now, DHS has denied every request I've made to speak to medical staff and take tours of the 3 facilities right here in Texas that are providing treatment. In McAllen, Texas, Levita Fergani, ABC 15 News.
You will hear stories from the illegal immigration front groups and apologists that these disease outbreaks are caused by a lack of vaccinations. But they will not also tell you that illegal immigrants are coming from countries that do not enforce any vaccination program. Borders are not about racism or xenophobia, but about protecting the citizenry of a population against threats which include disease. We must recognize that we have a crisis at the southern border, and if nothing is done by President Trump, we face the threat of once dread diseases rising again in great numbers, both in America and the world.
The Westwood One Podcast Network.